Back to Celebrity Radio. It's Alex Belfield talking to some of my favourite people, some of the country's biggest stars, and a man who always helps with my piles and rashes. Dr. Hilary Jones, how are you?
I'm fine, Alex. How are you?
Yeah, I'm good. But one of the things we're here to talk about today is this new campaign TK Maxx are doing Give Up Clothes for Good campaign. Tell us about it. It's for Cancer Research UK.
Yeah, so September is Childhood Cancer Awareness Month. Let's make people a bit more aware of childhood cancer. Something like 4,500 children in the UK every year are diagnosed with a form of childhood cancer. And regrettably, although that's 12 cases a day diagnosed, we lose more than one child a day from cancer. And you know, we have made strides in improving the situation, improving the quality of life for children living with cancer, and getting better outcomes. But there's still a long way to go. So TK Maxx have been involved in this charity called Give Up Clothes for Good for 15 years. But every September we highlight the initiative again and raise awareness, because we want people to take the clothes that they have in their wardrobes at home, their shoes in their shoe racks and the stuff that they no longer wear or need or love, and we encourage them to take them to their local TK Maxx store, where they can be processed and taken to Cancer Research UK stores and sold to the public, who will love them, who think, oh, that's nice, that's still in very good condition, that's a lovely fashion, I'd love to wear that. And the funds all go into some centres of excellence for research across the country that are painstakingly looking into what causes cancer in children and finding better treatments that target the cancerous cells, which stop them spreading and proliferating, and which give children not only a better chance of survival, but a better quality of life thereafter.
A dear friend of mine just had his child diagnosed with childhood cancer, and he's raising as much money as he can, Chris Angel in Las Vegas, and he's doing what he can. But it seems like it's a slow progress to find cures. Is there any sign that we're getting anywhere closer to sort of lowering these statistics, which are at best shocking?
You mentioned your friend there, and I lost my best mate at school at the age of 14 from leukemia. And I always remember that. It was instrumental in me sort of taking up a medical career and wanting to become a doctor. And you know, had he had that leukemia today, it might have been very different. You know, we've made huge progress in blood cancers. You know, children and adults, for that matter, survive much longer with leukemias and blood cancers today than they did just a few years ago. And if we can just translate that into similar outcomes and the better survival rates for children with brain cancers, bone cancers, kidney, liver cancers, you know, then we're achieving something. And we are doing this, but it's really painstaking work. We're finding out why cells behave the way they do, why they mutate, why cancer cells proliferate within the body, in nerve tissue and in other parts of the body. And if we can do that, then we're getting there. And this campaign seems to me so simple. You know, you take your clothes that you no longer wear, someone else can buy them, the money goes into cancer research, and everyone's a winner. Yeah,
they think it's about £30 a bag of clothes that they'll make in profit for the charity. So, right. and we are ridiculous. I mean, we look in our wardrobes today and we've just got tons of stuff that's still got labels on that we don't even use. It's obscene, isn't it? So this is a great way of doing something good with that and decluttering our wardrobes too.
Yes, and it has an environmental benefit too, because a lot of this clothing would go into landfill sites. And just be wasted. So it actually makes sense to recycle it, you know, and give it to somebody else who pays for it, and those funds are channeled into really good causes. So you're giving up your clothes for the cause of good.
Let's talk about you a moment, if we can. We're going to get onto some news stuff in a moment. What's your life like? I mean, are you still practicing daily at this point? Because I remember watching you on the TV as a kid, and there you were, and you still look about as young today. I mean, when you do GMB or Steve Wright, is this your proper job, or are you still in medicine sort of diagnosing the odd rash here and there?
No, absolutely. I still see patients. I'm not full-time now, but I like to see people on a one-to-one basis, because you can investigate them and reassure them about this and point them in the right direction. And that's where I came from. That's where I cut my teeth, and that's what I do. But also I do the media stuff and talk about public health messages and tell people how they can, you know, have a better and a healthy life. So it's a lovely mixture, and every day is different for me.
It's interesting, isn't it, how medicine on TV has progressed. I remember watching you as a kid, and it was all sort of very straight and to the point. And then we got programs like Embarrassing Bodies. And now, of course, to date people, we see each other naked. Is it interesting to you how the human body has developed in terms of TV and the media? Because it has certainly changed the last decade, hasn't it?
Yeah, I remember one of the first TV doctors, Dr. Charles Hill, preaching to the nation during the war years, and there he was, broadcasting on BBC, puffing on his pipe, slightly overweight. Things have changed. Yeah, of course, there are fewer taboos these days. Possibly we've gone too far and we sort of sensationalise certain things. People can be embarrassed about their conditions. But if you're that embarrassed, you wouldn't be on a program like Embarrassing Bodies, I guess, unless you were going to get a treatment that was funded by them. I don't know. I think it's good to raise awareness. I think people should be given some information, some reliable information, in which they can make an informed choice about where they go from there. And if people come to the doctor and they've only got 7.5 minutes with the GP, if they're forearmed with a bit of information that they can use to discuss with the doctor, then great. So I think TV and radio and newspaper articles have a role to play in educating the public about medical things. But as long as it's accurate and it's good and it's reassuring, then I'm happy. But sometimes we go a little bit far with the outrageous.
Help me with being a GP. Is there any hope that the queues are getting less long, that there's more money being put in, and that I'm likely to see a doctor any quicker, or is the sort of GP side of the NHS still as bad as it was a couple of years ago when it seemed to be on its knees?
Yeah, I wish I could say we could see an end to this, but at the moment it's getting worse. So we've seen about 500 GPs leave in the first part of this year, and we can ill afford that with people having to wait so long for an appointment. The problem is that, politicians promise us more doctors, 5,000 more doctors in the next 2 or 3 years. Well, where are they coming from? I mean, is this sort of magic trick? It takes 10 years to produce a GP, and we simply can't just find 5,000 extra. What we need to do is to retain the ones that we have and recruit more doctors going into general practice where the conditions are better and we can see more patients and give them more time. I know currently cancer survival rates are poor, and one of the reasons is because only 37% of cancers in the UK are picked up by GPs. It should be more like 97%. We should be detecting them, but if we haven't got time to properly talk to patients and examine them and investigate them, then this is one of the reasons why we're not doing as well as we could. So it's a two-way thing. We need more GPs, but we also need patients to look after their GPs, if you like, and realise that they are under a huge amount of stress, and help them any way we can.
And are we simply not paying them enough to attract people in? Because it seems to me it's a bit like being in a restaurant that, the head chef walks around tasting things, but the guy at the bottom has to clean the pans. You don't want to be the guy who's spending 10 hours a day doing that. And that is the life of a GP. It is laborious, isn't it? You see one after the next, and you're never going to get to the bottom of the list because another one comes in before you've seen the one who's just left your room.
Look, doctors don't go into their career for the money. I can assure you of that, and I don't think they want more money. I think what they want is the opportunity to make more of a difference by having longer with each patient. So we certainly need more GPs, and if you look at the continent, they have maybe 2 or 3 times more doctors per head of population. So of course you can spend more time with the doctor, and we desperately need that. So I don't think doctors are greedy. I don't think they want more money. But having worked in different capacities, I know that the life of a GP is full on from morn till night. They might not get a break. They might not get a chance to share a joke and a cup of coffee with their colleagues. It's absolutely flat out, and that's why so many get burnt out and retire early.
And a really vulgar question: do you think our lives being lost because of the pressure and the lack of doctors that there are up and down the country?
Inevitably, there's going to be cases where that happens. I mean, I know for a start that meningitis. We lose children from meningitis where the diagnosis hasn't been picked up, or because there's no continuity of care. If you have continuity of care, the same doctor seeing that patient, if necessary, every 12 hours. You're going to see an evolution of the disease. You see the child getting worse. But if that child is being passed from pillar to post because the GP can't see them and goes to hospital and you see the doctor sends them away with it's probably a virus or a flu, and the next doctor hasn't picked up on that message. If there's no communication, it leads to problems, and there's no doubt in my mind that more doctors would mean less medical mistakes and less litigation.
So this is a crisis.
It is a crisis, and I do hope that politicians stop being so short-sighted with making promises to win the next election and actually make a difference which is long-lasting, so that we can preserve our cherished and fantastically efficient NHS and the staff who work within it.
Can we talk about a couple of things in the news? One of the stories which I thought was interesting was about fat shaming last week. One of the comedians in America made jokes about the fact that the nation needs to be more concerned about fat people than terrorists, and I think he actually had a good point about America, and we're not far behind, that we forget the cost and the impact on our lives of eating fast food and being overweight. Fat shaming, no, that's probably not good, but we do need to do something about obesity. It's an ever-increasing problem, isn't it?
Absolutely it is, and there are all sorts of physical and psychological, social and emotional consequences of being overweight. So we know cancer, for example, and heart disease is related to obesity, but people need help to overcome the problem, prevent people getting overweight and obese in the first place. I think we hear about the word fat shaming. I think sometimes people do need to be reminded it's important for them to rein in their weight if they're overweight, and to be reminded of the consequences of that. But we also need, to cut down the. We need the food industry to address the problem of too much sugar, too much starch, too much, unhealthy stuff in the foods that we eat. These foods are cheap, they're inexpensive, there's not enough of the healthy foods, and we should be subsidising the healthy foods, the fruit and veg and the fish and the good stuff, and perhaps maybe not allowing so many fast food restaurant chains to open on the high street. I think there's multi-pronged attack could do this, but we also need people to be more active. And if we could get kids more active at a young age, and if they realised what it feels like to be healthy in the first place, perhaps we wouldn't have such a problem with obesity we have today.
And some people aren't going to like this, but I don't think you can argue now that vegetables are expensive and a piece of chicken. I mean, I get nervous that we make everybody a victim now and make excuses. I think it's hard to argue you can't make a healthy meal for less than a Big Mac Happy Meal. It's ludicrous. Carrots are 50p, lettuce and salad for £1. There are ways of eating healthy if you can be bothered, and we've got to sort of man up. I know this isn't a phrase they like these days, but there's got to be personal responsibility for your own health, because there's a cost to the NHS also that could take some pressure off that.
Yes, I agree with you, and one of the simple things we can do is to look at the portion sizes that we're consuming. We just eat far more than we ever did of everything, and so cutting down on the portion size and cutting down on the nutrient, sort of the calorie dense foods would go a long way, and then being more active, doing things that are fun, would make a big difference. And you don't need doctors to tell us that, really. But one of the things that I have to come back to is those things are all important. Obesity does raise the risk of cancer, of breast cancer, of stomach cancer, of prostate cancer. These things are within our remit. It's different with childhood cancers, because whereas lifestyle and environmental factors can contribute largely to adult cancers, we know, for example, smoking and obesity cause lung cancer and breast cancer, respectively. In children, it's different. These are mutations in cells, changes in DNA, genetic predisposition, even in the womb, and we need to tap into those. And that's why, coming back to the TK Maxx Give Up Clothes for Good campaign, is such a good campaign, because this is serious stuff. What's the website if people want to find out more? The best just go online to TK Maxx.
Great. One last story that I'd just like to give some clarity to this week. HIV has been in the news, and I know there's been such a fantastic development with the drugs for that, and a tablet that people can take that makes it impossible for them to pass it on, and it's undetectable. And this has been in the news this week. But the thing I haven't heard in the news is if you don't take the tablet or you don't know you've got it. And this is going to be, I think, the next stage of this story, that if you're taking the tablet, it's okay and you don't need to worry. But if you're not, or you don't know you've got it, it's just as worrying as it ever was, surely.
Yeah, I mean, it's important for everybody to practice safe sex. It's important for people, especially if they have a new partner, to make sure that you know each other's history, that if there's any risk at all, get a checkup first, because not everybody with HIV knows that they're carrying the virus, and that can be transmitted to somebody else. If you know that you've got it and you're taking antiretroviral medicines, that today we know that you can reduce the viral load to an undetectable level, so that it is much harder to transmit it to somebody else. But there's no room for complacency. We've done much better. There are less cases being diagnosed now than there were a few years ago. However, as I say, no room for complacency, and people still have to be careful.
And I think traditionally people have thought this is a gay illness, but of course it's not, because now so many people are sleeping boys, girls, girls, boys, 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 girls, girls, and it's passing on, and everybody should be careful. You shouldn't just think because you're in a straight relationship that your partner hasn't in the past been with someone else who might have passed it on. We've all got to be careful.
Yeah, absolutely, and it's not just transmitted sexually. It can be transmitted through dirty needles and other means. So, it's something that we should all be aware of.
It's always lovely to talk to you. Thank you so much for your time. We've got TK Maxx and it's Give Up Clothes for Good campaign. Put a sack of clothes together. They make about 30 quid towards kids' cancer, and we've got Cancer Research UK for children and young people doing this campaign, and we wish you all the best with it. Thank you so much for your time, Dr. Hilary.
Thanks, Alex.